Nuvance is unique in a couple of ways. First, it's a brand new program, and while many may find that to be perhaps a negative thing, because we don't have the structure in place that we're trying to put together, but others would find it exciting because they get to participate in helping to create that structure and to forge new pathways, which I think is pretty exciting. If you're a young resident and you want to really make your mark on a program and create a new, culture that previously did not exist. So I think in that way it can be an incredibly attractive program.
We are fortunate enough to have faculty that is Ivy League trained. We've got attendings that are from Harvard, attendings that are from Yale, from Columbia. So we have really strong faculty that is really hands-on and involved in our teaching and directly relay, important aspects of clinical teaching to us. So we feel extremely blessed to be able to have that opportunity to learn directly from them.
Many programs are located in one site and then they farm people out here and there, but our program is truly network-wide, and the residents rotate through all of our hospitals. And the advantage to that is that they get to see the subcultures that exist within each hospital. And that really helps to build their own skill sets in being adaptable, because the way things are done are not exactly the same in one hospital as they are in another hospital. The way people think, the way they approach problems is slightly different. And having that experience of having to make adjustments to the culture, I think is an incredible training experience.
We're actually rotating at 4 different hospitals. So you get to see geriatric psych at Sharon, you get to see crisis at Danbury, inpatient at Putnam. So you really get to see like a full range of psychiatry. And then also the patients that you work with, I'll work with a 14-year-old, and then, in the next step I'll be working with a 80-year-old or 90-year-old. So even ranges in terms of ages and things like that.
With this program, we have rotations such as integrated care, which allows us the opportunity to go into the community and actually see when patients are at the homeless shelters, interact with social workers to figure out how we can best place these patients and kind of overcome some of the hurdles that you otherwise wouldn't really be, wouldn't experience working on in other sites really, where it's just an inpatient psychiatry focus.
In each of our classes we have a certain wellness person assigned, and they're the ones who sort of talk with other programs in order to help develop wellness events and stuff like that. For example, we had our annual retreat, I think in July, where we all went to the Highland Center in upstate New York, and we spent the weekend there. We learned different skills, whether it be team building, leadership. We learn how to do certain forms of therapy with each other. Just experience, living with each other. We never usually do that. So you don't really know someone until you live with them, right? So this is a really nice opportunity for us to have.
I really like the area. I live about a block away from Candlewood Lake. I've done a couple hiking trails, Bear Mountain Trail, and a couple of other ones. So
the hands-on work experience that we have at the different sites, and then the wellness aspect of it, making sure that everyone's happy and feeling good. And when you combine all of those things together, I think that makes for the perfect recipe for success, really.
You get a very rich experience that's both broad and deep. But secondarily, we care about you as a resident. And what's really important to us is we know that you can't function at your optimum if you're not being supported by us. So our faculty are really, really in tuned and aware of how you're doing. And if there are challenges that you're facing from too much stress, too much work, because we believe strongly that environment either can bring out the best of us or it can really crush us. And that's not just true for our community, it's true for the people we educate and train as well. So we care very much about how the residents are doing and what allows them the richest learning experience available so that they can be at their best as well.